Hello, my name is Aleksandra Hristova, or Lex. I'm a cognitive behavioural psychotherapist and a senior lecturer in psychology.
Hello, my name is Nicole and I am a BABCP-accredited psychotherapist specialising in CBT,
Today we're going to talk about
gender and mental health.
Nicole, I know you've mentioned to me that you're interested in women's mental health.
Yeah.
And before we delve into the topic, which is gender and mental health, can you tell me how you got into that in the first place?
Yeah, so I guess I've had my own experiences growing up around trying to seek mental health support, and that was when I first noticed that the barriers we come up with as women. So we are faced with numerous challenges. That just made me realise that this was an area that I wanted to look into. And since being a therapist, I have noticed a lot of barriers that we face, and it's something that I want to work on being able to overcome and how we can do that.
Okay. So it sounds like you have a personal experience and also a professional experience.
Mm-hmm.
Yeah. Which is good to kind of be able to have both those perspectives. And I feel really similarly. I find that my interest in men's mental health, and specifically some of the things that get in the way to men seeking support, are really informed by my cultural background. Mm-hmm. Coming from a country which has a very strong kind of patriarchal ethos, meant that the men that I was surrounded with growing up always were very stoic in the way that they portrayed mental health, and never had the vocabulary to talk about it. So from a personal perspective, I think very similarly to you, I've noticed there are barriers in terms of gender, but I've also noticed it in my professional experiences, whether that's delivering therapy.
Yeah.
I'm sure you've noticed with your own patients when there's a particular block.
Yes, definitely.
And you try to understand it, and gender is such a massive thing. But also really interestingly, I don't know whether you experienced this when you were training, but the field is predominantly female, isn't it?
That is definitely true. I feel like there was only 2 men on my course, and it was quite a big course as well, so statistically.
How many people were in your course?
Oh, I want to say about 32, I think it was.
Yeah, so statistically, like you say, it's
big
mostly women.
Yeah.
I think the same. When I trained, it was mostly women, and now that I'm training clinicians, the percentage of people who apply to do the program in terms of gender, men are such a small percentage.
Yes, yeah. It's interesting that sort of you've noticed that whilst working in that training field as well. What is it that made you want to bring this to discussion today?
Well, I think we have a responsibility as clinicians to, first of all, understand our clients as best as we can. Whilst I know that within the therapy room, the therapy has to be person-centered, and we always want to understand it from a unique perspective, I feel like educating ourselves about gender can remove some of those barriers for our clients. So that's priority number one. And I also feel like as a clinical educator, I do hold some responsibility to increase the representation in the field. And given that is one of the barriers to, I think to men accessing support is the lack of representation, I feel like I have some responsibility there too. Tell me about your motivations to talk about gender.
Yeah, like you say, having noticed it on our training and in the therapy room, the education is definitely needed, and I think there's a lot we can talk about regarding the misconceptions and the barriers to accessing support, whether that is because of a cultural difference or just a societal pressure, and that fear of judgment can play a massive part. So I guess I'm wondering, like, what have you noticed then in particular in the therapy room?
Well, the first thing I've noticed is my own lack of understanding of some of the challenges that men, for example, might face in terms of the stigma that they might face. The kind of this idea that being in touch with your emotions might be a real weakness, or that talking about a problem actually makes the problem bigger in some way. Just off the top of my head, I'm sure that there's plenty more. But really interestingly, if I bring it back to you, if that's okay, I have noticed that I know very little about women's mental health as well, and particularly women's health and how that can influence what goes on for us. And I think that says a lot, the fact that I'm a woman, and yet I feel like I'm not educated enough about some of the things that might be going on for us. If it's not too much to ask, because you said you've had some own experiences of the barriers you faced to accessing support, what kind of things did you notice?
Yeah, I mean, if I start with physical health, when going to my GP regarding some physical health issues I was having, that's when I first noticed medical gaslighting is the term that we use now, where I was just told, oh, it's just stress, it's all in your head, none of these things are happening, or it's just because hormone related. That's a massive one. I felt like no one would listen. It wasn't until I went to see a female doctor that they started listening. In the therapy room now, I've noticed that this is something that actually pops up quite a lot, that it takes a while for women to actually get the support that they need, whether that's physical or mental health support, because they're seen as being too sensitive, too emotional, that something has to be really visible for help to be offered to them. We know with sort of hormonal shifts such as menopause, puberty, perimenopause, all that kind of things, that can affect our mental health massively. Yet when we go with the symptoms which suggests that we might be going through menopause, we're just told, come back when they get worse or
when
something.
Things are awful.
Yeah. And so then that creates a sense of, oh well, I'm not unwell enough to go to the doctors. Something that I've also noticed since working in the healthcare field is that we don't actually have much training on hormonal changes, and I guess the effect that has on our mental health especially. But yeah, I don't know if you've noticed that at all.
100%. And just to go back to what you were saying, it must have been so hard for you to just be gaslighted in that way. I mean, I hear about it a lot, and I know that it is huge on TikTok and on Instagram, women kind of speaking out about their experiences with healthcare professionals. And I absolutely know that there's going to be really good doctors out there and really good therapists who kind of see beyond the stereotypes and the misconceptions about women. But I also know that sometimes people are really caught up in their own stereotypes.
Yes.
Because of lack of education. And what I said earlier, until I completed a training day on working with menopause, I was just a victim to my own misinformation about how little can be done about women who are living with the symptoms of menopause, to now be very aware that CBT can be incredibly effective for things like that. It's been fantastic. But again, this is coming from someone who, works in the field. I should know more about this. So if I don't, then I can only imagine how little the general public knows as well.
Yeah, that's very, very true. It's a good way to look at it, actually, that even as women, we don't actually know until we've had training on it ourselves. So as healthcare professionals, we might have had that training, but the general public, as you say, they will only know what they've been told.
Or until they go through it and they suffer with all of the symptoms that could be managed better if education was given.
That's true. I wonder, is there sort of any male specific illnesses or anything that sort of you've noticed impacts?
No, it's a really good question. I think when it comes to education and the way that we see the gender differences, I think one of the main things is the fact that depression can present differently in men.
Right.
And again, that's not something that you necessarily are given in the textbooks or even during CBT training. But one of the main differences is in presenting with irritability and anger and kind of externalizing difficult emotions, which is much more common with men. And as a CBT therapist, that is something that I've grown to understand through my own experiences of providing therapy. It's not something that was given to me in a textbook. But imagine again, the general public might not be aware. If I were a man who was feeling really angry and the media is telling me actually depression is feeling sad, depression is crying, and in fact I feel just irritable with people around me, then I wouldn't put two and two together. So how would I know to seek out support if that is all I knew?
Yeah, that's a really interesting way to look at it, because as you say, the presentation is probably massively different. We do associate that anger with the masculinity, don't we?
Yeah.
The depression's more like that sadness, that upset, crying, those kind of stereotypes. I've been a little bit blind to that anger isn't necessarily, like, I feel like when I see anger, I think it's normally because someone's annoyed at something or they're feeling anxious about something which has made them go into that sort of fight mode. Actually, it's a difference in presentation from the standard textbook of sad, low mood, low motivation.
Yeah.
That's actually, I feel a bit, I don't know, like I feel like I've noticed it, but that I haven't actually looked that much into it. And just having that information now is going to make a massive difference to the way I look at things now. I hope more people listening see that as well.
Well, hopefully.
Yeah.
That's what we're doing. Similarly, what would you say is something that myself as a professional, but also as a woman, I need to be on the lookout in terms of some of the more specific symptoms that women might experience when it comes to mental health difficulties?
Yeah, I mean, I guess if we think about the clinical trials that have been done for whether that's physical or mental health things, women was generally excluded from those trials. It was mainly a male field. I think it was around 1986 that pregnant women wasn't allowed to do any clinical trials. So we're in 2025 now, and we've only had that much research, when the research that, I guess the information that we use in our practice is from trials which are ages ago, like before then. So that means that the symptoms we are looking out for or the presentations aren't going to be exactly as the textbook tells us, because women weren't included in these trials before then.
That is so interesting. I did not realize that we have realistically no data on women going through pregnancy. So many women will go through pregnancy and will have no idea what to spot in terms of the impact on mental health.
I mean, especially before 1980, was it 1986 I said, yeah? Especially before then, like there's going to be millions of women who was being pregnant, and the fact that no sort of clinical trials included them is crazy, really.
And that did remind me of something you said earlier, which is how long it takes to actually pick out on difficulties. Is it true that it takes more than 5 years to diagnose endometriosis?
Yes, I mean, it can take even longer than that, because it doesn't show up in ultrasounds, and then the doctor, as we said earlier, just keeps telling it, oh, come back when it's worse, come back when it's worse. It isn't actually until it's got to the point of, well, even when it's got to the point that you're in that excruciating pain, you're told that you're too sensitive, that you can't handle pain. You've just got a low pain tolerance.
That's awful.
Mm-hmm.
How do you think that translates into women accessing therapy?
I mean, as we're told that we're too sensitive as women, then we might think, well, we start to believe it, don't we? Like, oh, this isn't actually something I should seek help for because I'm just being too sensitive. Another massive thing is that fear of judgment, because we think about a lot of mums accessing mental health support. If they go and access that support, they might be seen as unstable. They might be seen as not able to do their role as a woman, as a whatever that may be in their household. Has that ever sort of come up when you've worked with men before, like any sort of fear of judgment from?
Yeah, I think spot on. Fear of judgment is probably one of the most significant barriers to men accessing therapy. And I guess I probably need to start by debunking a myth that exists, which is that there's a belief that mental health difficulties don't affect men as much as they affect women. And the reality is, if you look at the data, women tend to be more diagnosed or more affected by common mental health difficulties like anxiety and depression. But that doesn't necessarily mean that men aren't affected. And unfortunately, one of the really sad statistics that talks about the fact that depression affects men is the fact that 3 times more men than women commit suicide or die by suicide. So there's clearly something there, but there's also things that are preventing men from accessing the support. And as you say, one of the main thing is fear of judgment. And that fear of judgment can be individual and personal, but I think a lot of the time it's quite societal. Men are believed that they need to be seen as non-susceptible to mental health difficulties, for example. There's a belief that men need to be really stoic, that actually being in touch with your emotions or talking about how you're feeling doesn't equal stoicism. It means that it's a weakness. And when those societal pressures have been there probably since childhood for you, then I can absolutely see how it can stop someone from asking for support, because at that point you start to associate therapy equals weakness, sadness equals weakness, talking equals weakness. It's no wonder then that people don't reach out.
So what can we do then to improve the support, like improve, well, the stigma, like get rid of the stigma of the weakness seen?
Well, I think you'll probably agree with me here that we need to, first of all, talk more about therapy and what therapy entails. So I think I find it funny and probably a bit ironic that it's two women here, and we are, we're talking about gender generally, but we're also talking about men's mental health. So we absolutely need to increase representation in our field so that we can have these conversations with men who work in the field of psychology. But we also need to talk about what happens in the therapy room. We need to demystify some of the change processes, make it clear that actually CBT, cognitive behavioral therapy, aligns really well with a lot of the kind of the values that modern men, I think, are seeking out. I don't know if you're kind of aware of all the self-help books at the moment that talk about, maximizing your fitness regimes and, becoming the best version of yourself. And there's a lot of authors, I don't know if you've heard of Atomic Habits, for example.
Yes.
Those books went so big when they first came out, and the population that reads them, it kind of crosses the gender barrier. I think it's men as well as women that are really into that idea of optimization. It's crazy to me that people don't understand that that's essentially what CBT is all about. It is very much about getting really good and in control of your thoughts and behaviors and becoming the best version of yourself. That's what therapy is all about. So that's definitely, I think, one thing that we need to demystify, put out there, educate, reframe therapy. So that men feel more connected with the idea of it.
And I feel like what you've just said there about what therapy is and how we need to sort of market therapy is sort of what made me choose a name for my practice.
Okay.
Have you heard of the term "it girl"?
I have, yeah.
Yeah. And how that song came out?
Oh, I didn't know about that. There's a song.
So there's a song, and basically, like, if we think of all over TikTok, it's everywhere about being the it girl.
Okay.
And so what this is sort of defined as is being that person who sort of has it all together, has it, you know, just appears happy and confident, I guess. I thought, well, we actually want to be like that, and therapy is a way we can be our own it girl, the it girl of our own life, sort of thing.
Okay.
And I think therapy is seen as sitting on a couch and you know, just having someone keep saying to you like, oh, and how does that make you feel? That is what it's seen as. Like, if you look at all the beams about therapy, it's going to be that. But really, it's about that empowerment. It's finding yourself, understanding yourself, so you can be the it girl of your own life and be someone who appears confident and loves the life, really. And that's what therapy is doing, is identifying, especially with CBT, is identifying those negative thoughts, those core beliefs which might have come from your past experiences, maybe even traumatic experiences, which have shaped your view of the world and who you are as a person. How many times have we heard, I'm not good enough? Who are you trying to be good enough for? Because the only person that should matter is yourself. So therapy is feeling that empowerment, that confidence, because it all comes from within. And I think something I always say as well, it's sort of seeing that we want to have that external glow, but if we're not healed on the inside, you're not going to glow as much as you would if you'd sort of address these things that are on your mind and change some of the behaviours that aren't necessarily helpful for you. It's all about learning to thrive in your life, not just survive, because that's what a lot of us are doing. We're just surviving, but not actually thriving, which is what therapy can help with.
Great.
Yeah.
I love that. I do have a question though. Can you be the it guy, or does it only go for girls?
No, so there has been I think it's called the it boy is the new thing now.
It boy.
So, but
Great.
it's not as big at the moment as it girl. So pushing that is obviously a massive way to sort of market it as well, isn't it? Like the it boy.
Well, I love that. So I'm hearing what you're saying, and I'm also hearing another strand of thought there, which is that we probably need to connect better with social media if we want to reach people, and demystify really what's going on. Which makes me think of another important thing, which is that, you know, when we think of gender and how it shapes some of our beliefs and how it can be a barrier for both men and women to accessing support. And this is when we consider gender on its own, but obviously when it comes to intersectionality, things get even more complicated. If we consider, you know, we started off talking about culture, but if we consider, for example, for Black men, especially for young Black men, it's even harder to access these services. And social media is one of the really good ways that you can kind of break down that barrier instead of using the more traditional routes, which are normally, you know, healthcare professionals, etc. So I think there's something to be said about education and just reaching the right populations through the right brand, like you say, the it boy and the it girl.
Yeah, and I think that is where everything is coming from them at the moment, social media. I don't know if you've seen all the new series that came out, that adolescence and all about like Andrew Tate and all that kind of.
Exactly.
And I feel like the wrong things are being pushed onto us through social media, and it is all about what we engage with as well. If we've engaged with a post like that, even if we've engaged negatively with it, like so we've not agreed with it, it's going to pop up more on our timelines and our feeds. So if we start engaging with the social media which we want to see more of, and just I don't know if ignore is the right word, but not engage with the negative, the sort of negative self-talk and things like that, we're going to see more of that educational and things that are more in line with our values and on our social media.
Oh, I love that. Yeah. Bringing it back to values.
Yeah.
And portraying the things that we believe with and sending the right message. I think I'm going to start by addressing any men who might be listening to the podcast. And hopefully you've developed a little bit of curiosity about mental health and what it can mean, and whether it actually can display in a different way, whether depression can look differently for you, whether any of these messages that society has established are real, or whether we can challenge them. So I probably just invite you to reflect and think whether you grew up with any particular message about what it means to be a man, and whether you feel that any of those messages might be linked to feelings of sadness or stress or anger, as we've said, or shame or stigma or judgment. And to use a CBT technique, which is our bread and butter, or thought challenging, and to think whether perhaps there is any evidence that goes against that particular belief or that message. So if the belief is, I can't display emotions, otherwise it means I'm weak, is there anyone that has ever told you that maybe there's another way to look at that? So to challenge the thought and to try to think of an alternative way, and to try to live a little bit more in line with that alternative. So that's my reflection exercise.
Yeah, I really love that idea. So I guess just like you've said, that we should start reflecting on the beliefs that we have and how they shape the way that we see the world and act in the world. So I guess my call to action is, at any point have you found yourself not doing something because it hasn't felt like it's fit the role, or you've feared that you're going to get some sort of judgment from it? And if you have, what exactly was it that you was fearing would happen? What were those sort of anxious predictions that you was having? And what did you think that would mean about you? And like you've said as well, how can we look at the evidence against that thought? So if you're thinking that it's not going to be in line with this gender role, why is that? Can we utilise the positive side of social media to see why that should be normalised, that you shouldn't not do this because it doesn't fit with a role, or you shouldn't not do this because people might think this about you, when the only person's opinion who matters is yourself, is your own opinion. You should be able to access the support that you want and need, and not have to be fearful of what someone else might perceive that as.
And regardless of whether you're a woman or a man, connect with someone this week and speak to them. Ask them how they're feeling, tell them how you're feeling.
Yeah.
And if you're ever concerned or worried, remember to recommend therapists.
Yes.
Who can really make a difference.
Yeah, so if we want a better mental health for all, we need to challenge these stereotypes and push for that more inclusive, responsive care. Excellent.